Everyone. Today we are going to see what is psychological crisis or what is mental health crisis. Mental health crisis is a painful trauma or event or a person's reactions to a specific traumatic experience. Effect of crisis is varies from person to person. Sometimes crisis will help the person to overcome the dangerous life events. In that point, crisis is considered as an opportunity. Mental health crisis may lead to physical and psychological injury to the person. So, mental health crisis will affect the normal coping mechanism of the person. Now we will see different types of crisis. They are situational crisis, developmental crisis or maturational crisis, existential crisis, and mental illness crisis. First one is maturational crisis. When the person growing or moving from one stage of growth to another stage, they will face some adjustment problems. Or, as a part of growth, they will face a disequilibrium in emotions and behavior. This is called as maturational crisis or developmental crisis. Maturational crisis can be visible in adolescent period, adulthood starting period, and new married life period. Maturational crisis can solve through acceptances and support of particular person. Psychological support playing a major role in developmental crisis. This crisis is predictable one, so we can take necessary measures to overcome this crisis. Next one is situational crisis. Situational crises are developed from particular events and circumstances. They are natural, normal, and unexpected one. Examples include accident, natural calamities, loss of job, separation from family, etc. These events affect the physiological and psychological integrity of human being. Next one is existential crisis. This type of crisis is developed from inner conflicts of the person. They arise lot of questions to themselves like what is the need of living in this world? What is life? What is the purpose of life? Meaning of spirituality, etc. And these conflicts will arise lot of tensions, lot of stress and anxiety in their mind. This is known as existential crisis. Next one is mental illness crisis. This crisis is developed from mental disorders. A person who is living with mental disorders need to face lot of stress and this may lead to development of mental health crisis. After completing the treatment also, some people will face mental illness crisis. Most of the time, the onset of the crisis is sudden. This can be treated with the help of psychological support. Next, we are going to see the signs of crisis. They are fluctuation in mood, sleep irregularities, disorganized daily living activities, disturbed eating pattern, disorganized behavior, lack of concentration, and improper personal hygiene. Now we will see the stages of crisis. They are triggering event, escalation, and crisis stage. First stage is triggering event. In triggering event or in initial threat stage, the person facing the threat or event. In this stage, the person will use different defense mechanisms to overcome the stress and anxiety. Some people will adjust with situation with the help of defense mechanism and the triggering event disappears and there is no crisis. If not, they will go to the next stage of crisis. That is escalation. If the defense mechanism fails, the person will go to the next stage of crisis, that is escalation. In escalation stage, anxiety will continue and go to the severe discomfort level. Problem solving techniques like redefining the problem is not giving result means the person will face disturbances in their thoughts, speech and other daily functioning. Sometimes these problem solving remedies will work out. Otherwise, they will go to the third stage, that is crisis. In crisis stage, the anxiety will increase in drastic way and the person will show the symptoms of panic attack. At this point, people needed assistance from psychologists and other health professionals to find out the solution for their problems. Sometimes the problem will dissolve and the person will go back to normal life. If the remedies are not successful, personality disorganization will arise and the person will show severe symptoms like extreme confusion, depression, psychotic thinking, and harm to self and others. Now we will see an example for crisis. Jas is a studious student, wanted to achieve first rank in the public exam, but he failed in the exam. As a result of that, got anxiety and tension. To overcome this tension, he went out to drink alcohol. After drinking, he felt some relaxation and decided to go back. While coming back, due to fast riding of bike, he met with a car accident and later got admitted in the hospital. Here we can see situational crisis and three stages of crisis. That is, triggering stage, failure in the exam; escalation, drinking alcohol to reduce tension stress; crisis, car accident. Now we will see some crisis intervention. Assess the condition of the affected person. Do proper rapport with affected person. Maintain good communication skill. Listen the problem and allow them to explore their feeling. Accept and encourage to talk. Give psychological support. Find out problem solving remedies based on the situation of the patient. Use therapeutic communication techniques. Identify the problem. Do proper planning and implementation. Do evaluation and get proper feedback.